Hello, I'm Dr. Barrett. The following video is for my patients only. If you've had a procedure by another physician, please make sure you follow up with that doctor for your postoperative instructions or any concerns that you have. If you're having a medical emergency, please dial 911 or go to your nearest emergency room. Congratulations, you've just had a gynecomastia procedure, or you're about to get a gynecomastia procedure by me. This procedure is special and dear to my heart because I've actually had this procedure done, so I put together this entire list of postoperative instructions and recommendations for you, so stay tuned. Unfortunately, I didn't have the endoscopic technique that you most likely had. Now, if you had skin excess, you might have had additional incisions on your chest, but for the majority of you, you're going to have two small, tiny little access points. It's important to know that we put Steristrips on top of the stitches, but you still might have some leakage of fluid in those areas. You're going to have a lot of swelling. You're going to have a lot of bruising. That swelling persists for at least 6 weeks, and I tell most of my patients that it might take up to 6 months for that swelling to go down. So don't judge your final results right away. It's normal to have a little bit of bleeding through the Steristrips. If you had larger incisions, that bleeding will stop within the first 24 hours. If you have compression on, which I do for most of my patients, make sure to keep that on. Don't take it off unless you have to take a shower. Once you take your shower, then put it back on after you pat dry. So it's important to drink lots of fluids after your operation. The liposuction alone can actually cause you to be dehydrated, or the surgery itself can cause you to get dehydrated. Make sure you eat some food and advance your diet as tolerated. So after surgery, I want you walking around right away. Now, the main area that we did the surgery is in the chest, and especially right on top of the pectoralis area. So you want to limit any heavy lifting activity for at least 2 weeks. I also recommend not to exercise for 2 weeks because that's going to raise your heart rate and increase your swelling. After the 2 weeks, you can actually start to do some exercise, but again, it can't use the upper body because that's the area that we did the surgery. So legs, a little bit of abdominal muscles, glutes, those types of exercises are fantastic, and you can even do a little bit of jogging. Just keep the intensity kind of low and use your body as a guide. So it's important to know that you could have some numbness after the operation. Generally, that numbness in the area can return. However, nipple sensation may not return. It is a normal consequence of the operation at times. I might feel a little uncomfortable, but that's going to get better as the night goes on, and it'll be better by tomorrow. You can take Tylenol or CBD for pain. I recommend you don't take the Norcos. The Norcos are bad. They cause nausea, constipation, and they generally make you heal less fast, okay? So I'd rather you not take the Norcos, even though I prescribe them. They're there as a backup. When it comes to pain control, the CBD is the best option for this. You take a full dropper full, put it underneath your tongue, let it sit for a few minutes before you swallow it, okay? It's gonna absorb better that way, and take another full dropper full at nighttime when you're about to go to bed. So let's talk about the products I recommend for your recovery. I've personally hand-selected all of these items and tried them all myself to make sure that they are going to work for you and speed up your recovery and give you the best optimal results. So let's go through them one by one. The product I recommend for pain control and helping with anxiety is CBD. Okay, you can actually start this 2 weeks prior to your operation by putting a small dropper full underneath your tongue before bedtime at night. Now, after surgery, you want to increase your dosage to taking 1 full dropper underneath your tongue right when you get home and 1 full dropper at night right before you go to bed. You can take up to 4 full dropperfuls to help control pain of this product. Now, the reason why I like this product, it is very concentrated. It's 1,500 milligrams, which means it's very strong. You're not going to get this at any store. It's all organic, and I have added some terpenes, which are natural cannabinoids that will help control the inflammation and speed up your recovery. The best news about this is that it's not addicting, okay? So it works on your anxiety, it works on your pain, and it doesn't cause addiction. All right, so that's Barrett Recovery CBD. Masszymes. This is a product that is packed full of digestive enzymes, all plant-based, that are designed to help you digest your food after surgery, okay? Not only that, but it's been shown that these enzymes can travel to the site of injury or surgery and help speed up the healing process, okay? A lot of my patients report bloating and so forth after surgery. This helps with that. Remember, your gut is your key to your healing, and this product will get you there. For this product, I recommend you take 4 of these with each meal. Leaky Gut Guardian. I recommend this product after all my surgeries because it has 5 major powerhouses to help your body heal through the gut. Okay, a lot of people don't realize that taking antibiotics increases the risk of depression 6 months after its usage, okay? That's because it depletes the normal bacteria in our gut, which are responsible for a lot of the serotonin that actually contributes to our overall well-being and happiness. Not only that, but our gut is very much responsible for helping us heal after major stressful events like surgery. This product's great. It has 5 different things. Like I said, IgY Max breaks down bad biofilms, lactobacillus, which is a good probiotic to help replace the bad bacteria that the IgY Max is removing, prebiotics for that bacteria to thrive on, and then collagen and bone broth to further control the inflammation and help the other bacteria and provide you with more nutrients, okay? So Leaky Gut Guardian, you want to take 1 scoop twice a day on an empty stomach, you guys. It's got a nice little vanilla flavor that I like. There's also a chocolate one. Leaky Gut Guardian, this is a must. So Arnica montana is a natural herbal supplement that helps decrease swelling and bruising. I recommend all my patients take this after surgery, okay, to help decrease that. You take 1 to 2 of these twice a day after your procedure. It could be actually a lip filler injection or a facial filler injection in addition to surgery. I find it's much more effective and less harsh on the stomach. I recommend Living Fuel Omega Essential Fish Oil, okay? The reason why I like this is because it's harvested from very pure fish deep in the Pacific Ocean that doesn't have a lot of toxic chemicals like mercury. A lot of the cheap fish oils that you see at your drugstore or your supermarket or on Amazon, they're not harvested from the purest type of fish, okay? So you don't want to be putting toxins in your body. Fish oil is very beneficial. The other reason I like this fish oil in particular, it has a 1-to-1 EPA-DHA ratio, which will control your inflammation much more precisely after surgery than some of the more generic fish oils that you can get. So the dosage for this, you want to take 1 pill for every 25 pounds of body weight daily. This is one of my favorite products. It is magnesium. It's by BioOptimizers, and I like this product, and I've looked at a lot of different other magnesium products because it has 7 different types of bioavailable magnesiums. Why that's important is because the standard magnesium that you get over the counter isn't fully absorbed in your GI tract. You want to have all the different types of varieties of magnesium so that you optimally absorb the amount of magnesium that you need. Now, the reason why we need magnesium in the first place is because our soils are depleted because all the pesticides and herbicides we use, but that's another story. So if you don't have this after surgery, you'll notice that your muscles will be tighter and you'll have a lot more pain sensitivity if you don't have magnesium. So it works really well to help control pain, muscle spasms, helps you sleep at nighttime, and it helps with constipation, okay? So if you have any constipation, which can happen after anesthesia or taking pain medications, this helps tremendously. Take 2 of these right after your surgery and 2 right before you go to bed. So for vitamin supplementation, we recommend the product called Heal Fast. All right, there's a pre-op formula and there's a post-op formula because it makes sense. You want to optimize your body prior to having surgery 1 to 2 weeks prior with the pre-op formulation. Why? It's because most of the time after surgery, your GI tract doesn't work very well. All right, so you're not going to absorb things as well as you would pre-operatively. So we have the pre-op you want to start taking, and then the post-op. The post-op, you want to take 4 of these 3 times a day, and it has everything in it that you need to heal optimally. I actually have some patients that take this after they're done fully healing from their surgery because they love the effects. I'm big on scar management. I recommend the product called Skinuva. It has silicone in it. It also has fetal growth factors in it that help recreate the fetal wound healing environment for your scars. Okay, so if you ever notice fetuses inside the womb, they actually don't form scars. That's because of all those growth factors are there. Any kind of incision heals seamlessly. We try to recreate that with the Skinuva, which you want to apply twice a day to your scar after you're done getting all your stitches taken out and your Steristrips removed. All right, Skinuva, fantastic stuff. It also actually lightens the scar area as well, in addition to thinning it out. So we recommend silicone for scar-based management therapy, and the reason why is because it helps flatten out scars. We have creams that we recommend that contain silicone, but also silicone sheeting has been shown to apply physical mechanical pressure on the scar to further flatten it out for deeper or for thicker scars. The way in which you use this product is to place it on your scar and keep it on 24/7 as much as possible. You can take it off to shower, but then rinse it off and put it back on. I want to talk briefly about Steristrips. These are covering your incisions. If they fall off, no big deal. You want to replace it with a Band-Aid, all right? Now, sometimes your body swells with the Steristrip on it, and if that happens, it can form a blister, all right? And if that blister happens, that's okay. Leave it alone. You can put antibiotic ointment on it twice a day, and we will remove the Steristrip in the office. If you get an allergy, it develops a severe rash that's red and insanely itchy, okay? It happens on all the areas where you see this Steristrip. If that happens, remove all your Steristrips, wash with gentle soap and water, and take Benadryl and Claritin to help ease the symptoms. If you have any questions, give the office a call. We close your incisions in multiple layers. The deeper layers are using absorbable sutures to hold your wound together. Sometimes your body extrudes those and spits them out in a slight inflammatory reaction. And if that happens, it's not a big deal. It happens to about 20% of our patients. If you do see that happening, give us a call. We can take it out in the office, or if you feel comfortable, you can pull it gently with a pair of tweezers and trim it with beauty scissors so that it dives down below the skin incision, and then cover with antibiotic ointment for a few days or Steristrip. When to call us. If you're having a fever over 101 degrees, give us a call. The body temperature varies anywhere from 97 to 99 degrees, that's normal, but once it goes over 101 degrees, that's a potential problem. Also, if you have any significant bleeding or purulent drainage from any of your incisions, let us know. A little bit of bleeding is okay. A little bit of clear fluid is totally normal from a liposuction procedure. That's okay. But if you're getting a lot of bleeding or swelling in the abdomen area, that could be a sign of a hematoma. Now I'm talking like grapefruit-sized swelling. Okay, not talking about generalized swelling. If you haven't urinated in 12 hours after your surgery, you need to give us a call or call 911 or your nearest emergency room. If you are persistently nauseous, vomiting, and you can't keep anything down, you need to give us a call 911 or go to the nearest emergency room. Thanks for watching this video. I hope you found it helpful, and remember, don't forget to hashtag Barrett Recovery on your postoperative journey so other people can learn from your experience. If you have any comments, questions, leave them right down here in the comment section. If you like what you saw, don't forget to give me a thumbs up, and feel free to subscribe as you're waiting in recovery to check out all the latest videos coming out that we're producing.